Welcome to the Quick QI webinar series. My name is Nicole Adkin, and I'm a Quality Improvement Coach for the Excellence Through Quality Improvement Project, and I'm joined today with Alex Clement, who is also a Quality Improvement Coach. Today, we are going to go over Measuring and Understanding Your System, which is the fifth webinar in our series. On the agenda today, we will recap what is E-QIP, we'll go over the model for improvement, the family of measures, types of data, data collection, and run charts. So just to recap, the Excellence Through Quality Improvement Project is a partnership initiative between Addictions and Mental Health Ontario, Canadian Mental Health Association Ontario, and Health Quality Ontario. And we are here to promote and support quality improvement in the community and mental health and addiction sector. E-QIP is based on the sector's existing commitment to providing high quality, person-centered care to individuals and families. What is quality improvement? Quality improvement is a systematic approach to making changes that lead to better client health outcomes, stronger system performance and care for clients, and enhanced professional development. And quality improvement really is the responsibility of all involved, the healthcare professionals, clients, their families, researchers, planners, and educators. On this slide here, you see the three models: model for improvement, domains of quality, and the quadruple aim. And E-QIP uses all of these three models in our work. In the center are the domains of quality: equitable, timely, client-centered, integrated, effective, and safe. The domains of quality combined with the model for improvement takes us so that we can achieve the quadruple aim. And the quadruple aim is better population health, better care for individuals, improved provider satisfaction, and lower costs through improvement. Here we have the model for improvement, and the Measuring and Understanding Your System webinar answers the question, how will we know that a change is an improvement? Here is the project charter, which I'm sure you're all familiar with from our previous webinars in the series. In the circled areas is where we will capture the measuring that we're going to do in our project. You can see an area to record your outcome and balancing measures on the left, and on the right is the area where you can record your process measures. To demonstrate the quality improvement tools in our webinar series, we've been using a case study with the Live Well Recovery Services. The Live Well Recovery Services have had a long-standing issue with wait times in their programs and services. Specifically, this case is looking at the long wait times for their case management program from referral to service initiation. At the beginning of the QI project, clients looking to access case management services were experiencing a 185-day wait from referral into the program to service initiation. And using the model for improvement in our project, we're able to answer the following questions on this slide. Why did the agency decide to focus on this issue? How long had it been an issue? And also, details of the population that they serve. I'm now going to hand the webinar over to Alex.
Thank you, Nicole. So I'll be speaking to you about the family of measures, which include outcome, process, and balancing. The outcome measure is what helps us determine what it is and where we are trying to go, what it is we're ultimately trying to achieve, how we're going to reach that goal. And it helps us measure whether our changes are leading to an improvement. It also measures the voice of the customer or client to ensure that the work we're doing in our quality improvement project is speaking to those domains of quality. We also use process measures to help us determine if we're doing the right thing to get to the outcome. So as we make changes and work towards our ultimate goal, we want to also measure the workings of the system, and we're going to help determine whether the changes we're making are the right steps or whether they're having a negative effect or no effect at all. We also look at balancing measures because as we make changes in our system, we may create unintended consequences in other parts of the system. So these help us determine measures of other parts of our system. These could be positive or negative, whether it be increasing client satisfaction or increasing workload for staff. When applying these measures to our case study at the Live Well Recovery Services, our outcome measure is average number of days waiting for intensive case management services from referral to service initiation. Again, this is helping us determine how we are advancing towards our goal and ties directly to the aim statement, which is the following. We will decrease the average wait time from referral to service initiation into Living Well Recovery's intensive case management program to 10 days by April 1, 2019. The process measures they chose for this project are percent of staff that report high degree of understanding of eligibility criteria, number of hours administrative staff spend on referral process, and number of clients referred out of the case management program. So again, these are changes that they're making to their system, and they're wanting to measure these changes to ensure that they're working towards that ultimate goal and aim. Their balancing measures are percent of staff reporting excellent satisfaction, percent of clients reporting excellent satisfaction with the case management program, and average number of days waiting for alternate program if referred out of the case management program. So again, working those other parts or measuring those other parts of the system where unintended consequences might appear as changes are made. In terms of quality improvement data, we often talk about data that is good enough, and this falls into two categories. Our quantitative data, numbers that can be counted, they can be calculated or computed, whether it's just a number or volume, or also a percentage. So example being the number of days waited for case management services. There's also qualitative data that is descriptive and not expressed in numbers. So this could be narratives on a satisfaction survey. This could be feedback received in terms of either a client complaint or voicing pleasure with the system and seeing how well it's going. And it often really adds context to our quantitative data. Data collection is necessary in the calculation of family of measures, as well as during small tests of change. The collected data should be useful and relevant, and it should be easy and cost-effective to collect and embedded into the work process, so not creating any added pressures to staff. A data measurement plan is an effective tool that we can use to track each measure involved in our project and helps us plan that data collection process. So the example here for the Live Well Recovery Services agency, they have their measurement plan, which really outlines the details of the measures that they're collecting and how they're collecting them in order to create consistent data collection across the whole service. So the first example being their outcome measure, average number of days waiting for case management services from referral to service initiation. Here they describe how that information is calculated with the numerator and denominator, and the goal being 10 days or less on average. And they have some details listed as well under the data collection guidance, which talks about where the data may be coming from, the source, the frequency, and what samples they're looking at. Again, so we create consistency in how we're measuring. And it also outlines the person who is responsible for collecting this information. They also list an example of how they're collecting information for one of their process measures, being the number of hours administrative staff spend on referral process, as well as their balancing measure of average number of days waiting for alternate program if referred out of case management. Once we collect our data in a meaningful way, consistent across the organization, we can actually use that information in a run chart to tell the story of what's going on with those measures. So a run chart is a very simple graphical display of data plotted in chronological order, so over time, and the frequency could be daily, weekly, or monthly, really whatever makes sense for your project. It's a powerful tool and one of the most useful for understanding and communicating variation over time, and it's an easy tool for team to use, understand, and interpret, as well as share back with their stakeholders. It can be used very often in a number of ways, including understanding baseline performance, determining if a change that was made in the quality improvement project resulted in an improvement. It will also help determine if gains are being held after changes are made, and it can also help determine if there's a readiness for spread in your project after those changes have been made. There are a variety of rules for interpreting run charts. These include the shift, trend, run, and astronomical value. We've provided a link that will take you to a document that explains these and provides examples in detail. And here we have an example from our case study, Living Well Recovery Services, where they've plotted their data collected for their outcome measure, the average number of days waiting. And as you can see at the bottom of the chart on the horizontal axes, they have their measurements in months, and on their vertical axes, they have their average number of days waiting. So that's actually what they're measuring. They've also have here their median in orange, their goal in gray, so they know whether they're getting closer or farther away from their goal, and they have the actual data points plotted in blue. So as you can see here, they are progressing towards their goal, and it looks like it's progressing in a consistent manner. In the blue boxes, you'll see they've indicated or noted some of the changes that they may have made that are affecting that change in the measurement. We can also combine that with measures and run charts, like our process measure. So here you see that they were measuring the number of hours that administrative staff spend on referral processes, and they were measuring that on a weekly basis. And it looks like over time that this has definitely been increasing. So you can compare the process measure and the outcome measure to see why those changes may be happening. And they also have here the measure for their balancing measure, the number of days waiting for alternate program if referred out. So again, the goal in gray, they're progressing towards their goal, the median in orange, and the data points plotted in blue. As well, in that blue square, they have the notation when a change was made. So thank you for listening about data measurement and looking towards whether our changes are making a difference. If you have any questions, please do not hesitate to reach out to one of our directors, Michael or Debbie, as well as Jenna, our program manager. Their contact information can be found here. Thank you for joining Nicole and I, and have a wonderful day.